Before the FDA, before clinical trials, and before modern science-based regulation, there was a chaotic period in history known as the Age of Patent Medicine. These so-called cures were sold everywhere, by mail order, from wagons, in general stores, or at traveling shows. Despite the name, most patent medicines weren't patented. Instead, the term suggested legitimacy while hiding secret formulas that were often dangerous, addictive, or completely useless. The phrase snake oil salesman comes from this era. Originally, Chinese laborers brought traditional medicines to the U.S., including real snake oil made from the Chinese water snake, which did contain anti-inflammatory compounds. But American con men seized on the idea, selling fake versions with little or no snake oil, mixed instead with turpentine, alcohol, and other cheap ingredients. These men traveled from town to town, putting on loud, colorful shows filled with music, jokes, and fake testimonials, all to sell miracle cures that promised to fix everything from baldness to tuberculosis. Some of the most infamous products from the era were not just fraudulent, they were deadly. Mrs. Winslow's soothing syrup, marketed for teething babies, contained morphine and alcohol and led to numerous child deaths. Heroin was once sold as a non-addictive cough suppressant by Bayer, the same company known today for aspirin. Cocaine was marketed in toothache drops and as a treatment for fatigue and depression. These drugs were widely available and rarely labeled properly, so users often had no idea what they were ingesting. In the early 20th century, radium became the new miracle ingredient. Glowing and mysterious, it was added to everything from toothpaste to energy drinks. One of the most notorious products was Radithor, a tonic made of radium-infused water that was sold as a cure for impotence, fatigue, and a host of other ailments. Wealthy industrialist Eben Byers famously consumed it regularly until his bones essentially dissolved and his jaw fell off. He died of radiation poisoning in 1932, and his gruesome death was widely publicized, becoming a turning point in the public's perception of unregulated medicine. Patent medicine makers were masters of advertising. They used emotional appeals, bold claims, and fake doctors to give legitimacy to their products. Some even built cult-like followings. Lydia Pinkham's vegetable compound, aimed at women suffering from female troubles, encouraged customers to write letters about their personal health issues. These letters were often used in advertisements, creating a false sense of community and trust. The tide finally began to turn in the early 1900s. Public outrage grew thanks in part to investigative journalists like Samuel Hopkins Adams, who published a groundbreaking exposé series called The Great American Fraud, revealing the lies and dangers behind these products. In 1906, the U.S. government passed the Pure Food and Drug Act, the first major step toward regulation. It required labels to list certain dangerous ingredients and banned false or misleading claims on packaging. Later, the Food, Drug, and Cosmetic Act of 1938 expanded these powers, requiring safety testing before drugs could be sold. Despite the end of the golden age of patent medicine, its spirit still lingers in modern wellness culture. Products promising instant weight loss, miracle healing, or anti-aging effects often rely on the same tactics: slick advertising, vague ingredients, and emotional manipulation. The deadly history of patent medicine serves as a stark reminder: when marketing outpaces science, the results can be fatal.
I'll take two.